Hi, everybody. This is Leah Williams. I am the president of the Massachusetts ME CFS and FM Association, and we are delighted to welcome you to our first virtual annual event. And we're also delighted that this is in partnership with the Open Medicine Foundation. So we have a really exciting program today for you. Before we start, though, I just want to say a couple things about the webinar. So we're doing this as a Zoom webinar. So that means that the attendees can see and hear us, but we can't see or hear you. So you have two ways of interacting with us. One is that there's a chat box, and that's for sort of general comments. There's also a Q&A box. So if you have questions for the speakers, you can type them in there, and we will have people monitoring that and then relaying them. If you can address a question to a specific speaker, that's really helpful. And also remember that none of the speakers can answer questions about your personal medical situation. So try not to ask questions like that. Okay, so we have a pretty full agenda. Linda Tannenbaum from the Open Medicine Foundation is going to start us off with some introductory remarks. Then I will present our annual report to our members, which is required by our bylaws. And I'm going to tell you about some of the things that we've been doing and some of the things that we're really excited about doing in the next year. Then we'll have research updates from Ron Tompkins, Dave Systrom, and Donna Felsenstein, who are part of the Harvard ME CFS collaboration. Phil Chernin will introduce them, and then at the end we'll have a panel discussion and we'll answer your questions. So I am going to let Linda take over from here.
Hello, everyone, and thank you for joining us today. We are thrilled that you're here, and I'm founder and CEO of Open Medicine Foundation, and we're really sorry that we can't be there in person as we had planned originally, but with Zoom, we're able to reach so many more of you, so it really is a real bonus, and so we're glad we're able to do this today with Zoom. And we're tremendously grateful to our partners, Massachusetts ME CFS and FM Association. Thank you for allowing us to join your annual meeting and to give an update of what OMF is funding right in your backyard at our established Harvard collaboration. So I first want to give you a brief overview of OMF, and then we'll hear from Dr. Ron Tompkins to give an update on the OMF established research projects at our Harvard collaboration, and followed by talks from members of our working group, the esteemed Dr. David Systrom from Brigham Women's Hospital, and Dr. Donna Felsenstein, clinician extraordinaire based out of Massachusetts General Hospital. So I've had the pleasure of meeting some of you at multiple events that we've had on the East Coast, and many of you know who we are. But briefly, for those of you that don't, I started Open Medicine Foundation, OMF, the parent foundation, in 2012. And we now have OMF, OMF Canada, and we just launched this week OMF Australia. So we lead the largest worldwide effort to fundraise and facilitate research, to diagnose and treat, and ultimately prevent ME/CFS and related chronic complex diseases like fibromyalgia and post-treatment Lyme disease. We've raised over $28 million from private donors, and we've established and are funding 5 prestigious ME/CFS collaborative research centers now. And in fact, you're the first to hear us actually announce verbally for the first time the establishment of OMF Australia, with Chris Armstrong moving back to Australia to be the director and planning to open at the end of this year. The OMF established Collaborative Research Center at Harvard was launched in June of 2018, and Dr. Ron Tompkins and Dr. Wenzong as co-directors. So I want to give you a feel of the expanded OMF collaborative. The next few slides will show the founding members of each of our established centers, and it's growing, and so the names keep growing also. But you can see how large this collaborative effort is becoming, and you'll see that there's many universities and scientists and clinicians that are working together to find answers, which truly gives us all hope. So the Harvard collaboration, as we see, started in 2018 with Dr. Ron Tompkins and Dr. Wen Zhao as co-directors. The Stanford ME/CFS collaboration, we started in 2014. It was the first collaboration that we started with director Dr. Ron Davis. We established the Uppsala in Sweden ME/CFS collaboration in 2019 with Dr. Jonas Bergquist as director. The University of Montreal ME/CFS collaboration we also started last year with Dr. Alain Moreau as director. And now we have the Melbourne ME/CFS collaboration that we're starting this year. It'll start at the end of this year and the beginning of 2021 with Dr. Christopher Armstrong as the director. We have an 18-member scientific advisory board with 2 Nobel laureates and top world-renowned scientists, researchers, and clinicians that decide the most important research to fund. We fund the established collaborative research centers with recommendations from our scientific advisory board members. So thank you all again for listening, and to our partner, Massachusetts ME/CFS FM Association, and a special thank you to the participants in our studies and to all of you, our daily inspiration. We're all in this together. Thank you very much.
Thank you, Linda. Appreciate hearing about the OMF Collaborative Research Centers. We're all very excited about where that will lead. Okay, I'm going to share my screen again here. So I'm going to give a brief report on MassME CFS and FM Association activities. This is a required meeting that we have to have every year. And I know some of you are not members, but maybe you will become members. So we are the oldest patient-run advocacy group for ME/CFS in the US. We were established in 1985, and we grew out of some patient support groups that had begun in 1983. We're most active on the state and sort of local regional level, but we do have some activities at the national level. So we're really the Massachusetts Association. Over the last year, we have thought really hard about what we want to be doing and what we can do. And so we've come up with a strategic plan, a new mission statement, and I'll tell you a little bit about those. So our organizational structure is that we are a registered 501c3. We have an all volunteer board that meets 5 times per year. The officers are elected from within the board. We have committees who run our programs, and I'll talk a little bit more about what our programs are. And these committees report to the board. Most of our work is done by volunteers, and we really appreciate the people who can spend the time and energy to help us do what we do. In 2020, we had a big change, which was we hired our first staff person to run the support group program. And I'll tell you a little bit more about that. So our strategic plan, we wanted to sort of refocus on what we can do well and not spend too much time and energy on things that other organizations do really well. So for example, OMF is incredible at research, so there's no reason that we should be trying to do research. So we came up with a strategic plan and a mission statement that says to support persons living with ME/CFS and their families by connecting them to supportive resources and each other, and by working to improve the healthcare and services available through education and advocacy. So the entire strategic plan is available on our website if you'd like to take a look at it. And I'm going to talk just a little bit about our 4 pillars. So we tried to organize what we do around 4 main themes. So our biggest theme and where we spend most of our time and energy is support. So we are a patient organization and we want to support people with ME/CFS and their families. And so we have a number of activities that are related to this support function. Another really important function that we serve is to connect people with local services. This is something that we are actively trying to develop. So we want to be able to help people find support services, find medical care professionals, find home health aides. So this is something that we're developing, but we think this is something where we can make a big difference on a local level. Another pillar is education. And so we want to try to raise awareness among healthcare providers about this disease. We have a dream that someday there will be a center of excellence for clinical care for ME/CFS in Massachusetts. I think OMF probably shares that dream. That's probably many years away because it will take millions of dollars to make that happen. But in the meantime, our smaller dream is that there would be hundreds to thousands of doctors in Massachusetts who, when someone shows up with the symptoms of ME/CFS, those doctors can say, yes, I know what you have, and here's what I can do to support you. We know there's no treatment, there's no cure, but there's a lot that healthcare professionals can do to help people. And then our final pillar is to sustain the association. So we still want to be here 30 years from now, helping patients in Massachusetts live their lives. So we need a strong foundation to do this work. So we identified 24 specific projects that we could do to try to implement our strategic plan over the next 2 to 3 years. Of those 24, there were about 7 that we thought that we could start to do now. And I've got a little dashboard over here showing you that some of them we've already finished, some of them we're kind of halfway through, and some of them we're just starting on. Our main limitation is people. And so we are all volunteer, and we are limited by how many people we have who can participate in these projects. So if you look at our strategic plan and see a project that you think is really interesting and you would like to work with us on, please contact us. We would love to hear from you. So in the support pillar, and this is the bulk of what we do, we have something we call patient services. And so if you contact us either by calling our phone line or through the website contact us form, we will do our best to help you with information. We get about 200 contacts per year, and about 70% of those are requests for help or services. About 2/3 of those are for physician referral. So one of the things that we do is we have a database of physicians who have been recommended to us by other people with ME/CFS. And we then try to help match people with new physicians if they're looking for a physician. There's a very limited number of names in our database, and so we do need new physicians. So if you have been to a doctor who you felt was knowledgeable and helpful, please fill out the provider recommendation form on our website. We're trying very hard to expand the number of names that we have in this database. We also provide disability counseling. So a little bit later on, you'll meet Ken Casanova. He has decades of experience in helping people apply for disability. And of course, an important part of that is finding a doctor who can help you with the medical qualifications. I mentioned our telephone information line. This is actually just a voice message line. So you can call and leave a message, and we will do our best to respond within a day or two. We are, of course, all volunteers, so sometimes it can take a little while. Another part of our support pillar is our support groups. And this was something that we had one support group that had been going on for a very long time in person, and it was just really hard for people to get to the right place at the right time. And so this year we have hired a support group coordinator so that we can really amp up our support group program.
5 minutes.
Sorry?
5 minutes.
5 minutes, okay. So we have a number of new groups going on. We have open-ended discussion groups that are 3 or 4 times a month. We have a research club once a month, and we have a do-it-yourself club where people can talk about things that have been really helpful to them. These are, of course, now all virtual meetings on Zoom. So maybe someday they'll be in person again, but under connecting people to each other, we have our website, which has a wealth of information. We have Facebook and Twitter. You can follow us. We have a monthly newsletter. Anyone who wants to can sign up for the newsletter. We have about 2,400 subscribers. We have a new Slack environment. And then in the last couple months, we did these small group programs. This was one of our strategic projects where we had small groups of people get together and just meet each other and discuss what's going on. Under the education pillar, we had 18 events in 2018 and 2019, where we had an excerpt from the documentary Unrest and then a panel of patients and healthcare professionals. We reached thousands of people, including hundreds of healthcare professionals, but we were exhausted. So this year we have not done anything in the way of events, particularly besides this event. But next year we are starting to plan some events, one that might happen at a community health center and one possibly at the Massachusetts Rehabilitation Commission. For advocacy, we are not taking the lead on advocacy particularly. Solve MECFS initiative does a great job on that. We did participate in Advocacy Day on April 21st. We had a roundtable with Senator Ed Markey that Rivka Solomon organized. And there is, of course, this House bill that would provide funding for MECFS research at NIH. So we're encouraging people to contact their representatives. For sustaining the organization, if you're not a member, please join. There's a lot of benefits to membership. Our support groups, free admission to events. We do provide travel support for advocacy when that can happen in person. And then volunteer, we really need our volunteers. I think I'm running out of time. So I wanted to just say one thing. There's a research project at UMass Medical School that we've been a little bit involved with. And this is Lisa Sellen, who's on the right here, and Anna Gill on the left. They did get an SMCI Ramsey Award, and they're looking at T cells that are an immune response in the blood. We did help them by bringing in patients for a blood draw. So we were very happy to be involved in that research project. And they have also presented their research in our research club small group meeting. And we do really appreciate our volunteers. So this is a list of the people who have been involved in different parts of our organization over the last year. I just wanted to give a shout out to the Chad, Rachel, and Roby, who ran a virtual peer support group for a number of years. This was kind of a precursor to our current support group program. And then Kathy Robitaille, who was fielding all of the Contact Us requests for about 4 years. So she really did a great amount of work on our behalf. And then, of course, we have our board of directors. Normally at this meeting, we would be electing new board members, but because this is joint with OMF and because it's on a virtual event, we're going to do the election online in November of 2020. And then the last thing I have here is I wanted to invite these people to come on to the screen and just very quickly say hello so that you have faces to go with the names. James, can you set that up? Okay, so I'm going to have people unmute and I'll just call on you and you can say one sentence about yourself. So Susan Buckley.
Hi, I'm Susan. I live in Cambridge. I'm currently the treasurer of the association. I have a 21-year-old son who has MECFS.
Thank you, Susan. Pat?
Hi, I'm Pat Woods. I have a daughter with MECFS and I work on patient services and education.
And Lauren?
Hi, Lauren Alcher. I'm the volunteer coordinator and I'm also a patient with MECFS.
And Ken?
I'm Ken Casanova. I work on patient services, patient education, and do disability counseling.
Thank you. Jean?
Hi, I'm Jean Perrin. I facilitate the support groups and the do-it-yourself club and the research club, and all are welcome.
Charmian?
I'm Charmian Proskauer. I have a family member with MECFS, and I'm focusing on the sustainability pillar. So you probably will hear from me when it's time for us to ask for your support to help us to continue to do our work.
Thank you. And Phil?
I am Phil Chernin. I've had MECFS since the mid-1980s. I'm the past treasurer, and I'm going to be facilitating the panel discussion later on today.
Okay, and Phil is going to take over from here to introduce our speakers.